Manila, Claudia, Market.
Okay, it's good.
When?
Okay.
Yeah.
You ready for
Let me just send the link.
You opened it last week.
I wanna go and see it because I'm poor.
Well, then you go tonight.
No, I'm not gonna go tonight. I'm not prepared.
Alright. When it opened, he rushed to get it, and they opened last week.
That's a Coronado house is closing after 54
I know.
years.
That is so sad.
My auntie Pico can jar of mango and he
Oh, you have mango?
wait, no. During the typhoon, she pick up all the mango and she make 10 jar and she said to me, take this and kill it. And if they don't buy it from me, because I need to play bingo, I get it dispensed out.
Adrian,
Try to
So
talk
did you-
loud during the meeting, okay?
we have a
Because I don't know
spare
the quality of this sound
laptop
one compared
Yeah.
to
from the
my
Black
Mac
Rat.
last
Can you give me
month.
your steps? Write your names.
I'll have Alisa coordinate with you. Can you hook it up to register
To register? Oh,
Yes.
okay. Let me.
for OTEC
Well, I
so
just
that
sent
will
mine yet.
you can use it for
I mean, I
Okay.
okay.
Yeah.
Talk as loud as Mr. Meno.
Did you max out the
No,
volume? I think I
better not
muted.
Yeah.
stop.
It's
Okay.
it's going on, but it's there.
Oh, there.
Yeah, because this one over here is just for sound feed,
This one.
sound back. Yeah.
That's okay.
Yeah.
Okay.
Where can I find
I can hear
hydraulic
it.
jack? What store?
Napa.
No, I cannot afford that.
Home Depot.
Maybe I'll take
What about? Do you need it every day?
Ombi.
Just borrow it.
Ombi, I'm traveling and if you have flat tire, I cannot.
Is it working now?
Yes, it
Kmart?
is.
Even Kmart has it.
We're on.
go ahead and call the meeting to order. Okay, I'm going to go ahead and call this meeting to order. This is the Guam Community Health Center's Board of Directors meeting. Today is Thursday, August 20th, 2026. It is now 10:22 in the morning. We are here at the Northern Regional Community Health Center conference room. This meeting was posted in the Guam Daily Post on August 13th and August 18th, 2026, as well as the Government of Guam meeting portal. We are, it is, like I said, 10:22 when the meeting was called to order. Do we have any public comments? There's no public here to make comments. Okay. Next is we're going to table the review and approval of minutes from our July meeting. We're still waiting for 2 more board members to have a quorum. The electronic, we're going to go old business. I just want to recognize also our CPHO, Chief Public Health Officer, Catherine Ankau, for being here. Good morning. Thank you for being
On
here.
behalf of the director and acting directors, Peter John Camacho, please excuse he's unable to attend the meeting today because there's also another board meeting
Okay.
that he has to attend. And then Director Teresa Ariola is currently on an off-island conference for Medicaid enterprise.
Okay.
Thank
Thank
you.
you. So you will be you're
Yeah, I
also
will be
representing the
representing,
director.
yes.
Okay. And then we also have our Chief Executive Officer, CEO, Ms. Shermalyn Pineda. And then I want to recognize also who will be actually doing a report later, our Medical Director, Dr. Bob Leon Guerrero. Okay. And so we'll go ahead and go into the old business. Sherman on the EHR Next Gen transition update. And I want to just recognize that last week we did have Next Gen here with their team, and they were doing training, right? Or actually executing some of the programs.
So, Mayor, it was health efficient.
Oh, health
That was
efficient. I'm
Efficient,
sorry.
yes. Alan Mitchell.
Alan
Yes.
Mitchell. Yes. Okay.
So we are in the final phase of our transition. We're going to go live in 2 weeks, which is August 31. We're very excited. The Next Gen team will be with us next week. We just had a meeting this morning. All the staff at this point already know the system. We're still making sure we master it. So thank you for the board for allowing us Friday afternoons to do the training. But even before the Friday afternoons, the sections are meeting for trainings. And in fact, this Saturday, we also have another training set for the staff, because we really want to make sure that when we go live, we're going to be ready, because we won't be using RPMS anymore. It will just be Next Gen.
Are you confident on what was disbursed in terms of the workshop that they would apply
Yes.
in their area of work?
So yes, sir. So Next Gen actually has the capacity to tailor fit the system to Guam CHC. So right now we're doing that. We are reviewing all the workflows. We're reviewing the forms. We're identifying the things that we need, the things that we don't need, and we're trying to simplify it as much as possible. So we're going screen by screen. So that's something that we're still doing
Is
right
there
now.
anything that pertains to the director of public health in terms of there are many things
Yes.
that we deal with
Right.
that this board always question on the directorship?
So Alan Mitchell was here and was actually able to speak to leadership. He did have a meeting with the director, with the deputy, and with the CPHO, and he did bring up gaps that he observed. One of which is that our system is dependent on OTEC, and OTEC is serving the whole of Guam, and priorities can shift. So that's one of the things that we're going to explore later on, especially as we go into autonomy. We don't have to be with OTEC anymore later on. So that's something that
If
we're
we
looking
are
into.
autonomy.
Yes.
Yes, because what we're experiencing right now, because of the fluctuations in power, it is affecting OTEC. Just yesterday, our system was down for several hours. So those are the things that we're anticipating are going to happen, and we need to explore how we're going to mitigate that in the future.
The reason why I mentioned this to you as our CEO is that I was watching the director on TV, and she was talking about the behavioral, all the private clinic out there that mom and dad go to work and they have their children have to go. She was discussing that, and there's an impact on that on us.
Yes, yes.
So that's why I bring this up, like,
Mm.
the impact of those in the community that mom and dad have to go and work, because nowadays it's very difficult to have only one salary.
Mm.
So I was watching the director explaining all those things with the media,
Mhm.
and I'm very pleased with the director because he explained, but that also touches us.
Mhm.
Thank you.
Yes, for people to be able to go to work and go to school, they have to be healthy.
Healthy.
Yes.
Yes, yes.
Yes.
And then tomorrow, what we're going to do is actually work hopefully with pretend patients from the time they register all the way to them getting discharged from the clinic. And if any of you are available between 1 to 5, you can come in as a pretend patient, so we can do it in the EHR from the registering all the way to billing. Yes.
Oh, good. So,
Yes.
okay. So
So-
that's tomorrow between 1 to 5?
Between 1 to 5.
Okay.
And Chief, I'm also going
Yes.
to email the bureau heads and bureau supervisors that if they can have their staff come in as pretend patients tomorrow.
And that's going to happen here.
Here, sir,
Okay.
because the system is right here.
So I have a question with that, because you mentioned how, we'll be eventually separating with OTEC from OTEC. We have a backup generator here. Does that generator automatically kick in when the power goes out?
Yes, yes, it does.
So, I mean, just like other places,
Yes.
where stores, they have
Yes.
cash registers that are
Correct.
also computerized.
Yes.
And should glitch
Yes.
between island power and generator power go
Yes.
through, would it affect, it's just continuous, right?
Yes,
With the system.
because right now, so the power itself, we have a generator, but when OTEC goes down, that's
Their
what we
power
don't
goes
have
down.
control
Their
over.
system,
Yes.
because it's networked
Yes,
in.
yes.
Okay.
Because of her comment, the generator, do we maintain it properly?
Oh,
yes,
yes, sir.
that
Okay,
we have a
that's my
contract,
concern
yes.
there. The maintenance is very important
Yes.
on the generator.
Yes.
So because it would help us.
Yes. Okay. All right. And so I know that they've been the staff on Friday afternoons, because we approved the closure for the training, have been using, and that's everybody, including the providers, the medical records, right?
Awesome.
Everybody, and so it also helps with the financials, right? Because then the billing is updated
Yes.
in the system.
Yes.
Okay.
And the billing is able to capture all the information more readily than the previous system.
Okay.
Yes.
Okay. Very good.
Okay. So for the next one, for the northern
Expansion.
region expansion update, we're still working with the vendor and DPW. We have identified at least 10%, which was $60,000 that we can actually draw down from the grant. So instead of all of it being financed by the program income, and we have a scheduled ribbon cutting for the northern expansion in October. That we're going to do it in the same week of the primary care week. It's on October 6th at 2 p.m. here at the Northern Clinic. So we're still finalizing all the funding and all the balances for the northern expansion.
Sorry, we have to give a deadline on that because
Yes, Chief.
we already submitted the final FFR and there's no guarantee if we submitted an appeal that it will be approved.
Yes, Chief. So today, actually, or this week, I was able to speak with Emmer. I'm just gonna go to his office today.
Okay, thank you.
So October, what day?
October 6th, Mayor.
At what time?
It's at 2 p.m.
2 p.m.
here
here,
in the north.
of course. Okay, and I saw Bob, and the maintenance guys cleaning up that other room. It's nice.
Yes.
It's clean. It
Yes.
smells good.
Yes.
Of course, they changed all the acoustical
Yes.
tiles that were wet and damaged. So
The floor tiles, the ceiling
Yes.
tiles, he even painted the walls.
Yes.
Yes.
and so he explained to me how they had to use resources from within, right?
Yes.
Which is good because at least it reduces the cost.
Mhm.
So I just want to commend the staff
Mhm.
for their efforts
Mhm.
in just taking that extra step to find the resources from within because they took tiles
As
from
long
another.
as they don't use their pocket money.
No, they're finding
No.
resources from within the clinic, the health centers, to make sure that they're. I saw them stripping the floors and it's really smelled nice in there. So I thank them for making that effort to clean that up. He said it's not gonna look like the what's on the other side of the door, but it's getting close to that, right? And then, do we have the funding for furniture?
We're going to work on it, Mayor.
Okay.
Not right now.
Okay.
Mayor, isn't it during the last CHC board meeting when the director attended that we will reach out to the military or check on 'cause
On
there
the
were some-
survey,
survey.
Mhm.
So, Chief, I did
Signatures?
reach out.
Yeah.
I was informed that it's not furnitures. What they have is not furniture.
They don't have,
I forget what it is that they
office tables or
No.
chairs, not even chairs. No.
No. But the court did reach out to me. I'm not sure.
The cubicles.
Yeah.
Julie?
Somebody connected us. So we are able to get some not office chairs, but waiting room chairs, but it's like individual. So leather
From the
chairs
horse.
that are very, very durable. So
Oh.
they're reserving it for us. I think it's an excess for their offices.
Oh, really?
Yes.
About
good.
how many is that?
I think 20, Chief. Yeah.
Do we need help to pick that up?
No, not right now.
Okay. I mean, because if they have it even in storage, let's take it and put it in the rooms.
Yes,
Yeah.
Because
already.
you don't, when things are in storage, the mildew and
Yes.
the smell and things could happen.
I
So
will
if-
follow up.
And then if we need help to pick them up, we can check with our mayors to see if they can help with the transportation of that. Okay.
is it gonna be ready for the opening, the grand opening,
That's
the
what we're
ribbon
hoping.
cutting ceremony?
Yes.
Yeah, that's October
That's the
6th.
goal.
Yes.
October 6th,
October
right, Sherman?
6th.
Yes.
Because that's also in line with our celebration for
Of
primary
primary
care,
health, primary
yeah,
care
which
week.
is very timely.
Yes, yes.
So we will make sure it's ready, Mr. Mendo, because right now we're still waiting for the door that connects the new expansion to the old waiting room.
So
So
until now, it has not
no, because they had to order it, and
arrived.
Yeah.
and then we still have to do. We're still waiting for the EPA
Clearance,
inspection,
inspection,
and
yeah.
clearance.
Ah,
Yes.
Because we don't have an occupancy yet, so yeah. So hopefully within 2 months, right? Right? September, October. Wow,
August, September,
Yeah,
October.
a month and a
Yes.
half.
Yes.
That
should
we can.
be you should have arrived, right, Mayor? Or it's faster if you just pick it up yourself.
And that's what I'm saying,
Yes.
because if it's still there and they're going to leave it in their storage room until we're ready
Yeah.
to do that, I would rather bring it over,
Yes.
and then we can at least assure that it gets cleaned up, wiped down, and ready for us when we. I mean, I have a desk in storage. It's a wooden desk in storage just in case, and I also have 12 cushioned chairs with their armrests. I mean, I'll bring that over if we need to use it until we get furniture.
Okay.
Okay.
Okay. Okay,
Um,
Mayor.
I don't want to keep it in storage either, because
Mm.
I know how that works. Is it can get
Yeah. There were some cubicles that were offered. I think our challenge is disassemble and then
And
assemble.
assemble.
yeah. You need somebody that knows how to do that,
Yeah.
right?
So it's not just transportation.
Where are those at? Like the
The
court
Guam,
also?
yes, the Guam courts. Yes.
I'd like to go to the appointed director. GSA, usually the government of Guam turn in a lot of furniture to GSA. Maybe the director can check whether we can have,
That's exactly what she did. It's
Yes.
the GSA
Guam
has
Court,
the
yes.
surveyed equipment
Mhm.
that from the
what is
military.
it that we need that they have that they can give us.
That's the military surveys is what we're
Yes.
looking at too. Yeah.
It don't
Over-
matter
but
whether
it's
it's
not a
military or
furniture.
or a government of Guam, as long as we can utilize it for our organization.
Oh, I remember now, Chief. It was vehicles.
Ah,
The
yeah, because the military
has
is
Yeah,
the
vehicle.
yeah.
furniture, yes.
Yeah.
So that they have in their inventory
Yeah.
right now. Yes.
Okay. Well, very good. Thank you so much for following up on that and giving us the information. Because it's at 2:00, well, we need refreshments, right? So we can work on that as the board to do light
Yeah.
refreshments.
Yeah,
Finger
so maybe
stuff,
similar
to what we
was-
did for the
yes,
proclamation
that
signing.
was served. Yes.
That one I can make.
Actually, that was a lot.
It
last
was,
time.
yeah.
Well, because we were supposed to come here,
Oh,
And so-
Yeah, so
for
that's
the
why it was.
staff.
Yeah,
Okay.
thank you.
and
That
so
was a
yeah.
lot. Yeah.
that's why it
Yeah.
was that many.
Okay.
Yeah. Okay, but we're glad that at least, and we're glad that the visitors, the Korean,
The
Taiwan
yes.
students were there, and then Health Efficient was there also to see that. So it was good that they were able to try the snacks also, right? And I want to thank Sonia for staying and
Yes,
manning
thank
that.
you so
Thank
much.
you. Okay, and thank you to the board members, Annie for the water, and
Yes, thank you.
the others, Sonia and Eileen, as well. Okay,
It's hard.
and
There.
yeah.
Gave him
Okay, and so the review, policies, we're gonna have to table that until we get,
We should skip that until we have a quorum.
yes. And then the evaluation. So we'll go into your report table, okay?
Okay, so for the report, Next Gen Go Live is our highest operational priority. And then if you look at page 4, we have here a table comparing the 3-month operating periods in 2025 and 2026, May, June, and July. So if you look at the table overall, there is an increase in the
Oh, yes.
patients seen in 2025 and 2026. Um, but these are not just patients seen by our providers, but also by our nurses. So nursing
Wow.
visits, vaccinations, reading of TB tests, PPD tests. So new patient registrations increase and no-show rate has been improving. It went
It
down to
has,
as low
yes.
as 18.8%. We're hoping that in the next couple of months it can go down to um, as low as no-show rate has go down to 18.9. We're targeting at least 15% in the next couple of months. And then the walk-in also has increased. So in
Which is
May,
great.
yes, in
Yeah.
May alone, in last year, the walk-in percentage was up to 25.1%, but now it's up to 26.6%. So
Yeah.
we're really accepting walk-ins.
Yes.
In July, because of Typhoon Bavi, the volume decreased, but it was still high, right? I think the our takeaway from this table though is that pharmacy fills have declined in 2026, and it's declining because of the
The stock.
inventory.
Yeah.
Yeah. So I just saw a report that we are liquidating $130,000 worth of vaccines and some medications. And I was asking the vendor why they cannot
Deliver.
Fill the
deliver.
yes,
And it's because the cost has changed by the time they got
the purchase
The
order.
purchase order.
so that's $130,000 worth. We have almost $300,000 worth of medications for 340B that are
Oh, no.
sitting right now. There was a concern regarding so in the system it would show that we didn't have available funds. So it took us 3 weeks to address that back and forth with communication and going in the system. And after 3 weeks, and we said, okay, for our part, we already cleared it, and then so we have to wait. I already asked assistance from the deputy chief to push because that's almost $300,000 worth of 340B medications, and so we can see how it's really affecting the numbers. And when that's our challenge, when we are told we do not get local appropriation because we have the ability to generate program income and yet we do not have the resources to do so, then it's a very very big challenge.
Yes. I just want to share with you. I mean, and I've been watching because I have a new patient that my sister moved back
Yes.
here. She had, she's got medical issues, and so she's been seeing Dr. Polino. He's actually even give scripts to the pharmacy here, and so at first she was told that can't fill the prescription, so her prescription went to a private pharmacy, and what was good is that the providers actually also following up with the medications. And what happened is the private pharmacy called and said, "Oh, we received your prescription, and it's going to cost you $460 for Jardians, right?" And because Dr. Polino said they didn't have it here, but then the next day, the pharmacy called and said, "Oh, we have the prescription, and we can fill it here because we have the medication." That's one of the medications that came in, and they only paid $6 here because she's uninsured. She doesn't have income, right? And so she was able to. But I'm glad that the pharmacy here is also following up in communication with the providers as they provide the scripts. So that is actually helpful if because them going to other places, it is costly because they don't get the sliding fee, right? And here, our sliding fees are approved on the spot. I was surprised at the South that, you know, from the time they were moving from one section to another, by the time they got to the cashier, the sliding fee was already approved. So, you know, I just want to thank your staff because it's from the check-in to all the way to seeing the provider, medical records, everything, and then coming back. The patient, it really eases a lot of stress on how the patients are going to pay for their visit and then pay for their medication.
My concern there, Madam Chair, on the prescription. Do the pharmacy have a listing of
Yes.
what our community, our people
Yes.
that come here,
Yes, Mr.
to make
Meno.
sure that we have those medicines?
Yes,
Yes.
Mr. Meno, we have the inventory.
They have, yeah,
Yes.
Because what you're
Yeah.
saying is, I like what I hear,
yeah.
but to make sure that we have those medicines for our people.
Yeah.
So they don't have to go out and they get. I
Four-
understand. They're
$460.
charging me 300 some for some of the medicine that, you know, because it's outside.
And the good thing is when your refills are due, the pharmacist, you don't have to call because the pharmacist already
Have
has
already.
they will call you
The
saying
patient. It's
your
ready for
refills are
pickup.
due and we have your medications ready to pick up. So Dr. Bob, did you have something to say?
The issue I see is that pharmacy does not have funds to buy some of these medications.
We do.
Oh,
we do.
Doc, we do.
Oh,
Yes.
since
Yes.
when?
So we
We do.
actually have $300,000 worth of 340B net,
I'm talking about
340B
other
net,
stuff too.
and the vaccinations.
Because-
but
Yes.
Up to what, 2 years ago, the pharmacy was making close to $1 million.
so, Doc, it's not us not having the funding; it's the process of getting the medication from
It's
the
tied
requisition
from the requisition.
Yes, to all the way to getting the purchase order. Because imagine, Doc, we have $130,000 worth of vaccinations
Is there something that
To
we can do
liquidate,
to
yeah.
that's
speed up
going to
that
be
process?
liquidated.
Yes.
That's always been a problem. Not ever since I've been chief medical officer, the problem of filling our purchase orders has always been an issue.
Where is the stumbling block, Doc?
GSA.
GSA.
Yeah, GSA. And the director has tried to rectify that from this year's budget, that we got an increase in our small purchase from 24,999 to 250,000. But then again, it's the process, because it's another agency who processed our requisitions and translated into a purchase order. And as what Sherma have discovered with her team is that when we get the purchase order, vendors can no longer deliver because
the
there's a price
has
increase.
changed.
And it's also attached in our requisitions that the quotation that this vendor provide is only good for 90 days.
Yeah.
So we have to keep up to par on our order.
We are, Mr. Meno, but then again,
It's the process because
the
we're dealing with
process, yeah.
another agency.
Yes.
Yes.
Is there anything we can do to put pressure on that other agency?
Yeah. That's why
I
we're
don't see this resolved until that,
it's not going to be resolved until we're completely autonomy.
or new administration.
Maybe. I just found out yesterday though, because I was talking to a group of people and I was asking, where do you work? Where do you work? One of them said, I'm at GSA. I said, okay, maybe you will be my help to, and she says she works right with the chief procurement officer. And I was explaining to her about our medical dilemma is that our requisitions go in, but sometimes it's also our agency too, right? Where we turn it in. And like you said, Chief, the price quotations when we do an RFP, it's good for 90 days. But when they get the actual purchase order, it's 180 days, right? Or maybe 280 days, which is the price is changed by them, right? So
And then, Madam Chair, just to go back to you share the experience of the clients that the patient have shared with you is I would also like to commend our CEO because every time she have improved that process with her team regarding the approval of the sliding fee because when the first outreach that we did for the back to school, there was one parent who personally approached her and was crying and said, "How come my application? They said I have to come back after 3 weeks." So she made an improvement and corrected that. So and that's the improvement that you see that as soon as they complete the visit, they already got their
Yeah.
approval for the sliding fee program.
I was really impressed. Another thing is that the phone lines. You can call any number, and sometimes that recording doesn't go on. Now, because I've heard some people say, I don't know how to access that recording. Now you can actually, within the last few weeks, you can actually leave a message. And I'll tell you something, I was really impressed because not only did a patient get called by a nurse or somebody at medical records trying to make the appointment, but they also got called by the CEO. And when,
Yes.
when I
Yes.
heard her saying, yes, okay, what is your name? And she said, Shermalyn. I looked at her like, that's the CEO. But it was her number is listed as one of those numbers, and it was her direct line, and she actually took time
Yes.
to speak to the patient and said, I will get back to you, but can you come in on this day? And the process now, as a matter of fact, just this week, the providers are leaving their lab orders at the laboratory. So patients are not having to carry it in. When they go in there, the lab already has the order. All the patient needs to do is do the draw or the lab, and then they're gone. So
the charge can also speed that up.
Yes.
yeah,
Yes.
it's so thank
No
you.
more paper, yeah. For
Thank you to your entire team because it's everybody from the time you walk in. Like I said, they walked in, they said, you have insurance? She said no. And, she's a new patient. They registered her, but also let her fill in a sliding fee application. And by the time she got to cashier, it was already, this is how much you got approved for this. So thank you for changing those processes and the staff. It's a whole team effort. And like you said with the EHR, once you check in, it's from the time they sign in to the time they leave the clinic, the health center, that everything is already, you can see it on the chart, right? And then it makes billing quicker. So we're not waiting 6 months or 3 months to bill, right?
Yes.
And so when billing is faster, then what happens? Collection comes in, and our program income will go up, right? So I like the numbers, and I just want to commend the numbers have changed here. You're taking more walk-ins. You reduce the no-shows. New patients have increased. So these are positive things that are working in the favor of not just the patients, but also the health center. You can see that every person at the health center it's a team effort, right? So thank you.
I also like to report that we have to really plan ahead for the 2027 back to school clinics, because what we noticed was actually from the beginning of July up to last week, we have 310 appointment requests. We've never had this
Before.
number. So these are requests through our QR code and through walk-in inquiries. And so right now, because we're preparing for EHR, we cannot accommodate everyone, but we're already contacting the patients through phone calls and emails. And we're actually identifying which are urgent, which are time sensitive, which patients have already been seen. And so we're going to book them by October. September schedule is full, as well as our October schedule. But I've heard from the providers that we're going to start double booking in October, and by then we're anticipating that our staff would already be comfortable with the new system.
How can we rectify that? Those people that are. How can we help them?
Sir, we can only see so many in an hour, but what we can do next year is we can arrange the schedule, so maybe during back to school months we can extend our clinic hours. So that's something that
Yeah.
we can
Plan
ask
No,
ahead.
from
what
us.
I'm trying to find out from you is that there are some for vaccination and all these things.
Yes.
Mr. Meno, what we can do, the school are lenient about that as long as we can provide the parents a copy of their appointment schedule, confirming that yes, they have an appointment and will be seen. So at least the school nurse is expecting that okay, by this month or October, we should be getting your updated school physical and immunization shot or immunization record. Yes, copy that you're
Okay.
updated with the vaccines.
Okay.
And we do have a little bit challenge, I think, also is there are some clinics who does the physical but they don't have the vaccine.
Yeah.
So they're calling because there's one call that got routed last Friday with the Bureau of Family Health and Nursing Services that they have private insurance. So
And
but
that
because
depends on
we
the
are-
kind of vaccine.
yes, for kids, yes,
Yeah,
Mr. Mena.
because they
The
cannot go
schedule.
to school.
Right.
Yes.
So those are the concerns that I have.
Mhm.
In order for them to go to school, they have to have this requirement
Yes.
by law.
Yes,
Yeah.
Mr. Meno. It's
Yeah.
just so happened the provider that they brought their kid to have a physical doesn't have the vaccine. I think that's one too that we can ask our chief medical officer, who's also pediatrician, to promote that when selecting clinics, make sure that it's a one stop, that they'll be able to provide you everything rather than scouting again, checking with us, like, can we just get the vaccine because we already have the physicals?
We have to be able to do that ourselves.
Yes.
Yeah. And we've
Yes, we
had that.
have.
We've
We
had
have.
that issue
Yes.
where
We
we
were
have
not able to
we
provide the
weren't
vaccines,
able
right?
to give because they have regular insurance.
Yes.
We were only able to give those on Medicaid,
Medicaid.
and
and
not
no insurance.
uninsured, right? But now we have Dr. Bob. Don't look at me like that. So we've had that problem where
Yes.
We
why are
still
they
do.
going to come to us if we can't give them the vaccine because they have insurance?
We
Right?
still have that problem.
We still have that problem.
Yesterday, I had to tell a patient wrote a prescription for vaccines because I think they had one had military and the other one had select care. But we have vaccines for the kids going back to school, but the younger kids, the 2, 4, 6, 12, and 15 months,
Oh, we ran
we
out
don't
of
we don't
the
have
supply.
any.
Yeah. And so that's where we have the remember we had the measles outbreak and the pertussis, and that's
Oh, we
there-
don't. Just correction. We didn't have a measles outbreak
Oh no,
here.
no,
on Guam.
years
Yes.
years ago we did,
Yes. Yeah.
but we have the pertussis here.
Yes.
And so we find out, and Dr. Bob's finding out that the kids that were infected are the ones between infants to school age
Yes.
that were affected, and then they have a household full of people.
Mhm.
But the kids that were school age had their immunizations, but the little ones didn't.
So I think yes. I'm not sure if we ran out of supply from immunization program. They
No, we
they
didn't.
still distributed
We
it.
still have
We still
enough
have it.
for the
Yes.
older kids. I'm
Yeah.
talking about
No
the-
more for the younger, for the
less than
speed up.
18 months. We don't have private stock for
Yeah.
anything.
For insured.
For insured.
Yeah.
Yes.
Okay, Annie, did you have a?
Yeah, unfortunately, well, not fortunately, but I don't have a little one. The only one I have is 27 years old. But in addressing the long hours next year in preparation for 2027,
Yes.
I'm just curious, are we open all summer for them to prepare for
Yes.
back to school, or is it just a certain time frame?
They,
All summer?
all the
So
whole-
yes,
yeah.
so I think next year, because what we did this year was have the
In
special
reach.
clinics in May and
And
July.
then July,
I
yes.
think we have to do it June and July, and we advertise it as all through the week. Yeah,
And not just on Saturdays.
and not just on
Yes.
the weekends.
Because
yes.
that was overwhelming.
It
Even if you had
was.
all the providers.
Yeah.
And the good thing about that on the weekends is that the whole family came,
Yeah.
right? So it was everybody getting there. But if we do it in the middle of throughout the entire week, they can. It's summertime. They can still bring their children. As a matter of fact, when I used to be in the schools, we would encourage the families, because the physical is good for 1 year.
Yes.
We would encourage the families who have school age kindergarten kids to start getting their physicals in April. So
When I was at another clinic, and I was the
Before
chief
you got
of
kicked out.
pediatrics. Before I got kicked
No.
out.
yeah,
We started in July. I said January, excuse me.
January, yeah.
We tasked the MIS to pull out all the patients that were 4 years old, or will be 5 years old by the time school started, and we started calling them to make appointments so that they wasn't all of this last minute thing.
Mhm.
Right.
So I don't know if we can do that with
Yes.
ours.
Yes, we
We
could.
can with the
That's-
EHR.
With
With the new
Yes.
HR, we could.
Yeah, so that's what we did. We promoted, so we would have the staff call, and so that the kids that were coming to our clinic, there was not a lot of last minute because we were starting to do it since February of
Yeah,
that
see?
year.
Yeah.
So that's another thing that we can try doing.
Okay. Yes. Very good idea.
That's a good
Doris.
idea. So, like I said, the physicals are good for 1 year. If as long as they're 4 or 4.5, they can get those immunizations, right? And they'll be ready for school.
Madam Chair,
Yes.
Uh,
Mr. Mano.
can we have the do for vaccine and TB shot, TB test?
Can we what? I'm sorry.
When you go to the doctor
Uh-huh.
to get the vaccine,
Yeah.
can they check whether you have TB? Well, I'm talking about the kids. They check you, they give you your vaccine, and also they check you for
Dual.
whether you have
The PPD? You're talking about the
yeah.
Yeah, we do that.
Can it be done?
Yes.
Yeah, we do it.
We do it.
Yes.
Yes,
Good.
That's part of the
Wonderful.
that's what they do. That's part of the vaccine for entering school.
Yeah.
Yeah.
Just to make sure now that
So
what
we have no
the word
problems with
do
the kids going back to school.
Yeah.
BFC or
to make
private
sure.
stock
It's those 18 months and
and lower.
lower. Yeah. But so thank you, because like Sherman said, we've already had 310
10.
patients, right?
310 appointments.
Appointments, yeah.
That's
So
a lot.
yeah.
That's a lot.
Yes.
For the month of June and first 2 weeks of August.
And
So 6 weeks.
Yeah, and you can even bring that closer, like start even in, like you said, May, right? They started in February.
But if
Before
we
he
can do
got
that
kicked
other
out.
stuff with the new EHR, we
Yeah.
won't be stuck with that.
Yeah.
'Cause we
Right,
would be
yes.
already calling
We
them
will
and
beat
coming
the
in.
parents.
Yeah. That's great. And sometimes they just need that reminder, right? So that's a great
Well,
thing.
actually, what they did was they scheduled an appointment for them
Yeah.
to come in to get the
Yes.
physical done starting in
Yes.
February.
Yes.
That's great. Yeah. Okay, great. Okay, and then the CHC service and staffing update. Yes.
Oh, so for the staffing update for medical records, we lost another staff to promotion. So that's one staff last month and then another staff this month. So we're down to 3 medical record staff in the north and then 2 in the south, plus of course their supervisor. We did reach out to the Division of Public Health, and we're very grateful to the Bureau of Non-Communicable Disease. we have an LTA from the NCD who is coming to the Northern Health Center. She's going to start next week and will be working with us. I think 4 days a week,
For days?
4 days, but a total of 24 hours. So it's not 8 hours per
Okay.
day. But that's going to be a very big help, and we also were able to get somebody from Department of Labor. She's actually an LPN, but she's needing work hours right now. So I'm not anticipating that she'll be with us for a long time because she has a license. But that will also she'll also be helping out with med records. So whatever help we need right now, we're giving to med records, even with the registering new patients and moving information from the old RPMS to the new next gen. All hands are on board. We're asking the staffs from other sections to help out move information.
How about the request for profile?
Yes,
Yes, we got
Chief,
approval
we did.
from Acting Director Peter John that you can do unclassified
Yes,
employment.
Chief. So we
for
have
fast
submitted at
employment.
least four.
I haven't
For
received it.
Okay, so let me check where it is.
Yeah,
Yes.
because if we do the profile,
Yes.
then that means at least
Once they
I
get
think,
profiled
Chief,
by
it went to
DOH.
L'Oreal. Let me check where it went to.
Oh, but I still have to endorse it.
Okay, Chief. Let me check.
yeah.
Because L'Oreal will look for my
Hmm.
initial.
Because I
Yeah.
know we
Because
submitted.
once we receive a profile approval from DOA, then we can just do a GG1 appointment temporary to have them immediately on board while we're waiting for your own recruitment, because DOA is upgrading their system as well, so there's kind of delay right now with
Yeah.
with processing of the recruitments, not only from our agency but from other line agencies as well.
And because these positions were vacated, the funding is still there, right? For that.
No,
position,
not
no?
really, Madam Chair, because for when we had the new staff recruited, we did just a projection because we have not received our income, and again we're just Sherma has been working, as she said earlier, she's been working with her team for the past 3 weeks in doing reconciliation of their financials. So once we have some liquidations completed that's tied up to some POs, then we will have a solid record or proof that we do have enough income for the and to last until the end of the fiscal year.
You
Okay.
cannot have lapses.
Oh no, because it's a program income.
It's programming.
Oh,
Yes,
okay.
it's program income. So that's yours. So
Yeah.
even though you will have, if CHE will have lapses, then
Yeah.
the government will not take
They
it
cannot
away
take
because
it
Oh,
away.
okay.
Yeah.
yes, because that's your that's
Because they're not
their
giving us
program
money,
income.
remember?
Yes.
Okay.
Yeah.
So we're trying our best. That's why I have recommended to Sherma put all together all the financing in just one office,
Yeah.
because check also, like, if we can tap on use onto the grants, like cost allocate some of the providers that 100% being paid
Grant.
under a program
Right.
income, then that will in a way alleviate, and so we can hire support staff
Yes.
for the clinic.
Yeah.
Yes, using the program income.
Yes. So we'll get the providers and move them to a grant.
Yes.
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 Okay.
Yes.
Yeah. that makes more sense because
Yes.
they're providing the services.
Yes, yes,
the-
and it's allowed by the
Yeah,
grant.
Right.
Yes.
Right. Okay. That's fair enough.
Mhm.
Right. Okay. And that so that's and with the EHR,
Mhm.
I'm sure that it would reduce a lot of
Yes.
personal,
Yes.
human
Yes,
Yes.
tasks. Right?
mechanical, and
Yeah.
also Sherma have requested from the director as the state Medicaid director for Guam as well, is if one of the requirements of the Medicaid program on providing, because right now it's 100% of all claims billed requires a medical record, but if it's a low level service, if they can waive that, and we're ready to be
Mm,
audited anytime that Medicaid staff needs to do an audit, on-site audit. Because
Yeah.
that in a way will also cut the processing time as well and the required printing,
Mhm.
attaching, uploading.
Of course.
Yes.
Yeah. Okay.
Yeah.
Sounds fair, right?
Mhm.
Okay. And then so update on that's
The
any
update on
on the
Medicare.
Medicare. Yes.
So I think we're done with the PICO system. They already approved us in PICOs. But now we submitted just this week several attestations, the organizational chart, to WellPoint Federal. It was formerly known as NGS, and I think there was a lot of confusion because we were communicating with NGS because
Yeah.
when you look at the Medicare portal, all the clinics are under NGS. So we assumed we were under
Under
NGS, but because
no.
we are an
FQHC.
we're the only we're only the ones under WellPoint Federal. So now we're communicating with WellPoint because we're already cleared by CMS. Now we're giving our documents to WellPoint, and from there, they're the ones who will give us the notification of our enrollment information and our Medicare effective date, which will let us know how far back we may be able to bill the
Oh
Medicare.
gosh.
But
So
but this will not cover because we receive a waiver during
yes,
typhoon
yes.
disaster, right? So they will
Yes,
still be able to accept
yes,
those claims
yes,
until this. We have another 90 days, right, for
yes,
Bobby.
Chief. Yes,
We
Chief.
submitted another 1135 waiver for Bobby because that was a reminder of Captain Skip.
Oh no, not yet.
Oh, okay.
So
Yes.
if the governor's request is approved by President Trump for a disaster for Guam,
Yeah.
what would happen?
When we met with CMS, I believe they have shared with us that there is another for Bobby for the disaster that the CHC can just resubmit again because the submission of the 1135 waiver for CMS is based on the disaster identified or declared by HHS. Yeah.
Under the public health
Public health, public
Emergency. Yeah.
Yes.
Yeah.
So us, because that we were able to be given a provisional enrollment that during that period while WellPoint is processing our application as a Medicare provider, we were given that waiver that we can be able to bill Medicare for those patients we saw during
the public
Sinlaku
health,
for
yeah.
the 90 days because the public health emergency is for 90 days and also for Bobby.
Mhm.
So we have until for Bobby August. Because there was an overlap, Mr.
yes.
Meno. The Sinlaku public health emergency ends the 90-day July 10, I believe. July 9, I think. And then we had the Bobby
Yeah.
before that. So it overlaps. So we have another 90 days for Bobby. So that's July, August, September. So we have about August,
Till
September,
October?
about October.
Yeah.
Yes.
Wow. Okay.
Just want to make sure that
Yeah.
we are in order.
Yeah. Okay.
Yes,
And so
yes.
so we'll find out how far back we can bill, right? We can
For
send- for
that's outside of the disaster.
right.
Yes.
Right. Okay.
Yes.
Once we get the notification from
Official
WellPoint.
notification.
Yeah.
Yes.
This would really help, with our program income,
Yes.
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 and it'll increase that.
Mhm.
Then we'll be back up to our normal, right?
Yes.
With,
And then it will also allow us because there's some who are do have dual coverage, have Medicare and Medicaid, then we can collect the patient
Both,
share
yeah.
from Medicaid.
Medicaid,
Yes.
yeah. Okay. All right. That sounds fair, right?
Mm.
Okay, so we're getting closer, right?
Yes.
Okay, thank you very much for both of you, CPHO and Chief and Shermerlin. Thank you to both
You're
of you for
welcome.
being very aggressive with
Yeah.
this. because we are losing money. We've lost money not being able to bill the Medicare.
Yes.
Yeah, right. Okay. Q and I initiatives.
So our most recent QI initiative is on the diabetes and tuberculosis screening. We began in July 13. So this is in participation for the QI efforts with APCHO. I forgot. It's
Apcho.
Okay,
It's
with
Apcho.
APCHO.
Yeah.
There is a time frame, but we have decided, the team has decided that we're doing it from July to forever. So because this is a very good initiative for our patients because of the high number of diabetes in our clinic, diabetic patients, and of course the um, TB on the island. So we were able to get patient feedback from 26 patients, and 96.2 were very satisfied with the TB screening process. 88% strongly agreed that testing instructions were clear, and 84% completed the chest x-ray and or the IGRA blood test. So we're still refining the workflow. We're improving documentation. We're using the point of care A1C testing when appropriate. So when they come here and they're identified as having diabetes, then we do the A1C right away. So we're still monitoring screening and completion rates, and we're trying to strengthen a standardized diabetes and TB screening process across the health center, and that's in collaboration with our TB program.
Thank you so much. Okay. Any questions for the CEO? No. Dr. Bob,
Yes, ma'am.
come over and do your medical report.
So not much different than the last time. We have Dr. Lee, who's signed only a 1-year contract because she was wanting to do full time. So that's coming up, and she's been actually adding, because we made it up to 39 hours. She's been adding more hours to her clinic time. Dr. Billing has also added more hours. So.
And are the patients coming in?
Oh yeah,
That's great.
Especially down south. I look at Carlo and Dr. Billing and Dr. Lee's. They're getting filled up more and
Good.
more.
That's great.
And so we're also having UH come out again, and they're going to be shadowing and helping out with the colposcopies to make sure to see that Dora and Carlo can, and it's making our women's health clinic much more attractive. So
Yeah.
we just need to find some way of advertising it.
Yeah, and we need to use our PIO more. I'm still waiting for her to give me the photos. I don't know, did she take everybody's photo already? Because she's supposed to do, several months ago, I asked the staff to work with her because I'm willing to pay for the poster. I was going to just do the names, and then they said, no, we need to put their pictures.
I gave her a format there
Okay.
for how to do it.
Yeah, so she's just supposed to put that together.
Who is our PIO?
Julia Rivera, Naputi Rivera. It's from the south.
She actually made I have an interview with KUM on Monday to talk about the CHCs.
Yes.
Oh, great.
Yes.
Wow. Yeah. So, and then we can keep playing that. If we can get that and play it on not just here at our clinics, but in different
But then
places.
have to wear sunglasses whenever.
Who's in movie star?
In regards to Dr. Duenas,
Yes, Dr. Duenas.
Yes.
he's still in the States. And I sent out an email just today to find out, because he said he was going to come back in. He's going to come in September.
Yes.
That's just next month.
Next
Yeah,
month
next
already.
month. But we'll see. And then the other family practice, we are not pursuing.
because we don't have the money.
Yes.
Yeah. But and this is what I continue to also, whenever I have the opportunity to be on radio, right? Is I continue to promote women's health because you hear that people can't get appointments with OBGYNs and to do maternal health, right?
Mhm.
But I said the health centers have, and I promote also Dr. Lee. You have Dr. Billing there, and then you have Dr. Dolores Lee, who's joined our forces.
I mean, before we were backlogged with colposcopies, we had to send them off.
Yeah.
Now we're
Matsuda,
Yeah,
they're
now
all
we're-
done.
yeah,
All
now
done
we-
there. Yeah.
we have the capacity to do more.
Yes. So, as a matter of fact, I mean, even people in government agencies are saying, "We heard you talk about this," and we have people, staff that are pregnant and they still don't have a provider. I said, "Call the health center." I send them the QR code, and they actually because what happens here is they come in the mornings, they get screened, and then if they're positive, that's when they shoot them out and make the appointments with the provider. So. And they live in the South. They said, they're down in the South, right? So
And actually, Dr. Billing prefers to go down south.
yeah,
To
yeah,
do there's more room for the colposcopies.
yeah. So I'm glad that we're glad that that's happening because again, the more patients that are there, the better it is for the health center, right?
More money.
And our providers because it gives them things to do, right? And when they have babies, then the babies go to the pediatricians, right?
That just as a side,
Yeah.
I had told the nurses to double book me for 2 years now. Not just recently.
Actually, doctors triple book,
Yeah,
not just
still.
double book.
Yeah.
But that's still a problem, though.
Yeah, because it covers it. It
Yeah.
makes up for the no shows, right?
Yes.
So he
yes.
fills in those patients. Yeah.
Are we entitled of that $1,000 from Trump when you have baby?
Not you. 'Cause
No.
you had 15 kids already, so you're not entitled.
No, for now. Is Guam entitled for that?
Nobody's gotten it yet.
No, not
Nobody
yet.
even in the States.
Yeah, but this is what he
That's
said.
just a given.
Yeah, okay. Remember what? Oh, no, better not say it.
Yeah. Okay.
Because I'm not a politician.
Yeah.
I don't know how to say
Okay.
it.
So thank you, Dr. Bob.
Okay.
Anybody have questions for Dr. Bob? No questions? Okay, we'll move on. Financials, July. Financial.
Also, it's an attachment
Thank you.
for the July for this is June.
No, July.
No, it's July.
Okay,
It's July.
Okay,
It says July.
okay.
Yeah.
So for the total, so I guess this is June expenditure, July expenditure. We're at 527,097, and that's including the operations, which covers our utilities, our memberships, and then of course the salaries and benefits. Program income, where in July we're at the client collections for the month of July is at 170,802.
And
And
about for the insurance, we
Oh,
have
I-
not reconciled that yet.
I will have to follow up, Chief.
Just remember, we followed up. There are some like about 4 checks that we have not received
Yeah.
from the Medicaid, but
Yes.
it's already posted. That
Yes.
has been remitted to us.
Mhm. So I will follow up the insurance and the checks. So right now, the available funding that we have is at 130,920. We have requested for the LODA for the month of June. We have not received any response yet. But we're only expecting for the month of June less
About
than 100,000.
Less than 100, right?
Around 80,000.
No, because the total collection is about 83,000 only.
Mhm.
But we have not We don't need to deduct because we have allocated
Yes.
in our current account up to July.
Up to July.
Yes.
Chief.
So that 83,000 is more or less the
That's
entire.
it. Yes.
Okay.
So for the billing, Southern is the billing is at towards the end of June. Auditing is the end of July. For Northern, billing is up to the end of February, and auditing is in May. We will follow up regarding the requisition that we submitted in August. August.
Yes,
In,
first week of August. For
August
the small purchase,
vendor.
for the billing.
Yes,
Yes.
for the billing vendor. So
So for the benefit of the board members, director have recommended, she have recommended it since the very beginning, is we contract a billing vendor to work on the past claims, to work on the backlog so that our staff will be working on the current claims. So we're anticipating that the vendor who will be awarded of the PO will be able to catch on to the how many months that we have a
from
backlog
February.
from Feb. No, I said February is already billing end of February. So starting March to
March to
June.
yes, Chief. Okay. And for the grant funding updates, it's on page 7. So we have the SAC grant right now and title grant. We did submit grant applications to 4. We submitted 4 grant applications, and and they are pending, and we have not confirmed award status. We did submit one grant application to for Medicare purposes, the Make America Healthy Again. We did not get that application, but we'll try again next year.
Okay. When do we find out about the other grants that were submitted?
I think, Mayor, we're gonna find out this month because the beginning of the grant period is, most of them are September.
Yeah, okay.
Yeah. So we'll find out.
Oh,
this month.
September.
Yes,
Yeah.
some are
Grant.
September 30, some are
there.
September 1st.
Okay.
Yeah, so we'll have to find out.
We should be
So-
able to see
Yeah.
the notice or
Yes.
receive the notice
Soon, yes.
Yeah.
soon.
So Shermalyn, I know that you submitted a grant last week, right?
Yes.
So now we talked about,
Yes.
I'm gonna ask for supplemental funding from the legislature. Like you saw, if you've been watching their budget, they did a supplement for the airport, and and they're autonomous, right? And the airport gets a regular allotment annually from the legislature. So as long as we have the numbers, exact numbers, and what it's going to be used for, we've always been healthy, but for all these disasters and all the stuff that we've been faced with, as long as we can justify what the need is, and we don't, when we're not returning money, because we don't get no allotment, we have no carryovers for them for government allotment, local funding. There's resources where we can tap into that are taxes that are increased because for health purposes, and we are a health organization for primary care. We just do the breakdown and exactly what we need it for. Maybe even if it's to help us fund the CFO position, right?
Correct.
And
So
also, Mayor, the repair of the
Exactly.
roof at the
So-
south.
So I did
How
reach
many?
out,
Yeah.
Chief, about the funding for the infrastructure. There
Yes.
was And we were told that we're still waiting for the disaster
Declaration.
declaration.
Yeah.
So there's no disaster declaration yet, so that funding cannot be used yet. Yeah, or even designated to whoever. Yes.
Are you talking about the governor?
Yes.
the president-
The president.
Yes. Yes.
To make the
Yeah,
declaration.
when I say the governor, because the governor is going to request to the president.
Already.
Already, I heard that last night that our governor is requesting.
Mm-hmm.
But let's go back to what you were saying
Mm-hmm.
on that funding,
Mm-hmm.
the rainy day funding. We do have that in the legislature.
Okay.
So she's saying that we can ask.
Especially for our preparations to become autonomous.
Yes, yes.
Yeah. Okay.
So we're
Yeah.
putting those numbers together.
Together, yes.
Yes.
And then once you have it together, then I'll make the appointment
Yes.
with the different senators. It's not going to hurt. They're here. They have to continue to work until December or January
Mm-hmm.
when they're out of office, right? So let's go ahead and put our Christmas wish in, right? And all the worst that could happen is they say no, right?
It's good
At least
to
we
ask
ask,
now
yes.
because they want it to look at them.
Yeah.
Yes.
Before November, yeah.
Yeah.
Okay.
Okay.
All right. Thank you so much. Okay. Any what's next? Grant, okay, that's revenue cycle. Okay. Treasurer's report. Okay. Annie does have
Okay, treasurer's report, I do need to update it
Yes.
as we did write out some checks in preparation for the raffle that's upcoming. So as of not accurate, right now we're looking at 3,148.28, and I can announce already that I saw a check